We did a systematic review of social media HIV interventions. First of all, I want to thank our great co-authors, including our moderator, Joe Tucker, and many my co-authors were from WHO Southeast Asia office and the University of North Carolina. So we declare low conflicts of interest. I think people in this room, we are all very familiar with this background. The UNAIDS goal of ending AIDS by 2030, and we target at 1990 by 2020. So I'll not elaborate more here. The other side of the background is the quick development of social media globally, I think. Here I take China as an example. The first part is, the left side is about WeChat. That's the largest social media in China for generic population. WeChat is built by Tencent group, and Tencent building is just across the road from our university. So the picture you saw here is shooted by me in June. I just passed by and took this photo, and it shows that they have 1 billion monthly active users now, and that's just nearly to like all the Chinese population. So it's I think they are dramatically influencing our life. And in terms of social and sexual networking apps for gay people, Bloody in China is the largest app, and they have now 40 million users according to their new reports. So you see, like, many people are using social media, and then more and more social media interventions have been implemented. Lots of advantages of using social media as an intervention tool. Dr. Tang already mentioned several advantages. I'll just repeat a little bit. It can help reach a more diverse audience. It can reduce overall costs. It can provide opportunities for repeated exposure to these messages, and it allows real-time feedback, and it encourages lots of engagement. So here our study focuses to see whether social media interventions are effective in HIV prevention, and if yes, how do social media contribute to HIV intervention? We did a systematic review and a meta-analysis. We followed the PRISMA guideline and reported in Prospero in September 2 years ago. So here is a brief figure to show how we screen the studies. We identified around 1,000 abstracts using our searching terms, and then we excluded those ineligible studies, and finally we have 26 studies that included in our systematic review. We did quality assessment, and these are all the 26 studies that included in our analysis. So here is the results part. Among the 26 results, 18 were observational studies, and 8 were RCTs. And you can see we had 18 also studies from high-income countries. And some dots are the cities that the study was implemented. So among the 26 studies, 15 articles used generic social media as intervention tools. Generic social media including like Facebook, Twitter, QQ in China, and other social media that are used for general population. And another 10 articles used gay apps as intervention tools. That's like Grindr, Jack D, and Bloody in China. So there are some other studies that use both of these kind of platforms, and also there are some studies that generated their own platforms. most of these studies, they considered MSM population as the key population. Dr. Tang has already mentioned the 4 roles that social media played in social media intervention. So we used these categories, and we identified for each category how many studies used these roles. So for establishing virtual communities, we consider it can provide emotional and informational support, so the MSM can interact with each other and provide support for each other. There were 10 studies that used this role. And for the second role and third role, disseminate information and deliver services, each function has 9 studies. They can neither provide informational support or instrumental support, so MSM or other key population can get information and other resources so they can get HIV tested or get other HIV services. And the next one is related to developing intervention materials, and that's instrumental support for the HIV intervention organizers. And we identified 1 study using this function. And then we conducted several meta-analyses. Here is the figure that we pulled. Those studies used pre- and post-intervention. So when you see the figure comparing the HIV testing rates at baseline and post-intervention survey, the HIV testing rates significantly increased after their social media intervention were provided. So it's all at left side. Right side. So also we pulled another 5 studies that used RCTs and also target at HIV testing as outcome. So among these among these 5 studies, we can also see the results shows that when the social media interventions were participatory, the HIV testing rates were significantly higher than those in the comparative arm where there's no social media interventions, or the social media intervention just provide general health information and also were not participatory. So those social media intervention using more participatory features were more successful. We also examined those studies that that offered HIV self-testing to their participants. So there are around four studies we identified that provide these services, and but some provide missing data, so were not included in the table. On average, around 15% of participants requested HIV testing, and around 57% of participants who requested HIV testing kit returned HIV testing kit. And then the positive rate among these who returned HIV testing kits were 1.5%. So here is a conclusion. So we can see that social media interventions were effective in promoting HIV services, especially in increasing HIV testing rates in high-income countries and aimed at MSM population. Different roles played by social media were identified, and social media, we think, can help achieve 1990 goal. And here is for further studies or for future studies, if you have interest in working on social media interventions, we want to discuss with you that so most of the studies we identified in this study they are primarily focused on MSM population. So how about other key populations? Is that possible that social media interventions can work on sexual workers or drug users and other population? And also, most of the study consider HIV testing as the main focus of social media interventions. We are also thinking of other HIV services in the cascade. How about the ART adherence? Can we improve adherence through social media? I think some studies do apply to HIV adherence, but seldom studies may use some social media features. That's the interactive and participatory features are seldom used in such kind of social media interventions. And also, some people may wonder whether using existing social media platform would be better or create a standalone platform. We know that if we use our existing social media platform, we can't customize and personalize the services that can be provided. But when we use a standalone platform, then there would be few downloads, and it seems it's difficult to get lots of people use that app. So these are the points that we can think more. And also, because this study have been conducted like around 2 years, so I think there are lots of new studies that we cannot include in current systematic review. But I do think this still we can do lots of work on this part. So I want to acknowledge all the founders and some other people who helped us with this systematic review. So thank you very much. The paper has been published, so if you have interest in more details, you can also refer to that article. Thank you so much.
Thank you, Dr. Cao. Any questions for Bolin?
Really nice presentation, very good overview. While you were talking, I was wondering, although you see an effect in the testing induced by social media, do you have any ideas to improve the effect over where we are now? And could we include the social media in the discussion? I'm just asking you how for the future, what are the next steps and how can we improve?
Thank you very much for the question. Yeah, I think currently social media have already played multiple roles to provide help, but still I think it's, for example, like Dr. Ang mentioned some drawbacks of using social media intervention. I think there relates to some challenges we still facing. For example, the social stigma. Still, if you want to use social media to scale up your HIV testing services, you want people to share it forward to others. But still, for example, in China, where high stigma still exists, people don't want to share their information out. And that makes our information still kind of constrained in some small population. So how to go beyond that and make it can really go viral. The information can be seen by as many people as they can. As other advertising information, that's a challenge. And if we can solve this kind of challenge, I think the effect can be larger. Yeah, that's one of the points. I think there are other points that maybe also Dr. Tang can also answer some, but I think, yeah, it's true, as I mentioned, if currently we are focusing on MSM population and also just HIV testing, we may also need to think more about other population and other services that we can provide through social media. Thank you.
Yeah, and I think given the stigma, as you mentioned, associated with HIV. I was wondering, would it also be an option to more integrate into communication about general health and make HIV a part of general health promotion more than like isolated, just focusing on HIV? You think that would be a feasible approach, or?
You think that we can combine HIV service into general health promotion? Is that your idea?
Yes, yeah. Also to destigmatize it more, right?
Yes, I think so. It's a great idea, and some online consultation apps in China, they also include HIV like consultation services and other related to like, for example, we also can find HIV testing sites in WeChat. You know, WeChat is just for our daily social interaction, but there are also some mini apps that embedded in such platform that we can gather information, and we know the resources where we can get HIV tested. So there are some efforts try to solve this. But yeah, I do think this is a great idea, and we can, in this way, maybe we can try to deal with the stigma part, because now it's difficult to try to change the social norm dramatically, but then that's something that we can do in the current stage. Thank you.
Thanks, Dr. Cao. I think Natalia had another question.
Yes, thank you very much for the great presentations from both speakers here. I have seen that you put in the discussion point around other key populations, and would like to learn, even from a preliminary data that you may have had on the transgender women population, because we have found this quite a unique a population where all those existing social media platforms that we have used for MSM very effectively may not work at all for this population. That's the first question. The second question is around the other use of social media to enhance services along the cascade that you have mentioned, ART adherence, for example. I also would like to hear more, if you have any data on the use of social platform to enhance PrEP uptake and probably even PrEP delivery, very similar to you promoting HIV testing and then deliver the self-test kit to the clients.
Thank you very much for the questions. Yeah, for the transgender data, I don't have it at my hand. I don't know whether Dr. Tang can share with us later. But I do think it's interesting to see why currently not of studies focused on MSM population, because gay apps just develop so quickly and not a lot of people are using that. I think that the challenges for other populations, we still have kind of difficulties to identify these populations. I don't know a specific app that can just be used by transgender like women or like individuals. So if we have such kind of networks or apps we can use, then I think that kind of studies can like quickly created, but now, yeah, I think that's one of the issue. Maybe one day, if transgender people have their own platform, things can be easier. And in terms of the second point, yes, I think PrEP is. I think it's a great. There are great opportunities for using social media to promote PrEP. I think it should be similar as HIV testing kits, although PrEP in China is currently kind of costly, and it's not. I don't know whether we can get enough governmental resources that can provide PrEP free or other, because currently most of the HIV self-testing kits, they are delivered to the participant free. And for us, the cost is not that high, right? But for PrEP, because and the target population need to use PrEP daily, and then the cost can be even higher. But I think the idea can be spread through social media, definitely. And yeah, other services, I think still social media can be used, but still not as helpful as if you directly give them the testing kits and they can use it. That's so convenient. And others, if it's just information and other resources not so direct, the effect size may be smaller. Yeah. Thank you very much.
Thanks. And the next question, is this directly related to Dr. Cao's talk, or?
Yes, it is.
Okay. One more question.
Thank you very much, Dr. Cao. So I come from Singapore, and I just want to add on to one of Dr. Nitaya's points about hidden populations that may not be traditionally served by the social media platforms. So in Singapore, one of the other key populations affected by the HIV epidemic are older heterosexual male clients of female sex workers. And I think in multiple attempts to try and reach this population, there have been difficulties. And in fact, in trying to design social media or online interventions to reach them, it's also been difficult. Like you said, so many gay apps, but not really any quote-unquote straight apps to start, you know. And the other question that I had is, what about the integration of social media into applications and platforms into research modalities? We've been trying to reach, for example, recreational drug users and use social media apps as a means of integrating into respondent-driven sampling, for example, and we've met a lot of hiccups along the way. So I don't know whether you could share any experience or any data that you might have on this. Thanks.
Okay, great. Thank you very much for your question. So, in terms of sexual workers, we are also thinking of like reaching these populations through social media. But we do also, similar to you, have had some difficulties. Most of the cases in Shenzhen, I heard they also still just use offline channels because I think. Through online, definitely there are many sexual workers. They are now using online channels to reach their customers, but they are not attentive to such kind of information when they are using the internet. So I haven't figured out a very effective way that can really persuade sexual workers to do this. But I would hope to discuss with you and see the lessons we learn from each side, and maybe we can create some effective way. And also, your next question is related to, your next question is related to, can you remember?
Integrating social media with respondent-driven sampling.
Okay. Yeah, that's also a great idea. Like the response-driven, the RDS is a great way that we can expand the effect of social media intervention. But for most RDS, is still, I think, use like your personal network, and some people, it's just social media can help you to make announcements through your personal network. For example, we also identify some like key opinion leaders in MSM, and we hope that they can also recruit their friends to participate in our study. And then now they don't need to tell each friend, like, do you want to participate in this study? Now they just need to post on Facebook or in China, the WeChat moments, and saying that we have a study that doing this. If you want to join this, and then you can participate. So that's the part that social media can help with the RDS. Yeah, thank you very much.
Thanks.
Thank you all.